Hello and welcome. If you're experiencing that nagging hip pain that limits your movement and makes everyday activities a challenge, you are definitely not alone, as many people struggle with discomfort in their hips, which can truly impact your quality of life. Hip pain can interfere with walking, sitting, climbing stairs, or even sleeping, and many people accept it as normal, but it doesn't have to be that way. Today, we're going to explore a powerful two-step solution designed to bring you relief and lasting strength, focusing first on releasing muscle tension and then strengthening the crucial muscles that support your hips so you can regain comfort and confidence in your movement. Often, the primary cause of persistent hip pain isn't a structural issue, but rather tight knotted muscles, specifically the gluteus medius and minimus located in your outer glutes, which can become incredibly tense and develop trigger points. These tight areas, also known as muscle knots, can form over months or even years due to poor posture, sitting for long periods, weak muscles, or repetitive movements. When these muscles are tight and knotted, they can refer pain to other areas, meaning the discomfort you feel in your hip might actually be radiating from these specific muscle knots, and this referred pain can extend to your pelvis and even your lower back, creating a widespread sense of discomfort. You may notice that certain movements, such as standing up from a chair or twisting your torso, trigger sharp or dull pain in seemingly unrelated areas, making it confusing to understand the source. Identifying and addressing these knots is the first key step toward lasting hip relief. Step 1. Tennis ball release. Our first step is all about immediate relief, using a simple tennis ball to release those painful muscle knots and alleviate the tension that contributes to your hip pain, a technique surprisingly effective and capable of providing significant comfort very quickly. This method is simple, inexpensive, and can be done anywhere at home without any special equipment or prior experience. For this technique, all you need is a standard tennis ball and a firm surface to lie on, such as the floor or a firm mat. Begin by lying down on your back with your knees bent and your feet flat on the floor, allowing yourself to relax and focus on the muscles in your hips. Preparing mentally and physically will help you get the most out of the release technique. Now, let's find the right spot by gently rolling onto your side, specifically the side of the hip that's experiencing pain, targeting the outer gluteal muscles located on the side of your hip just below your hip bone, and place the tennis ball directly onto this area. Once the ball is in place, gently roll your hips and shoulders towards that side, allowing your body weight to settle onto the ball, not pressing hard yet, just getting a feel for the area, and slowly move around until you find a distinct aching or tender spot, often described as a good hurt, meaning it's uncomfortable but addressing the problem. This sensation indicates that you have located a trigger point that has been contributing to your discomfort. When you find that tender point, stop moving and stay still, allowing your body weight to apply gentle pressure onto the ball, focusing on relaxing your hip muscles as much as possible. You might feel some initial intensity, but as you relax, the muscle should begin to release. Relaxing fully and taking deep, slow breaths during this process is critical, as tension in your body can prevent the muscle from releasing effectively. Hold this position for approximately 1 minute, focusing on deep, slow breathing to help your body relax and allow the muscle to release more effectively, adjusting the pressure if needed by lifting your opposite leg slightly or rolling just a tiny bit off the ball. You may feel a gradual decrease in the aching sensation as the knot begins to soften and the blood flow increases to the area, bringing relief and a warming sensation in the muscle. After about a minute, or when you feel the tension begin to subside, adjust your position slightly and move the tennis ball to target different areas of your outer glutes, addressing several tender spots if needed. And remember to support your head and neck comfortably when lying on your side. Avoid pressing the tennis ball directly on any bony parts of your hip, targeting the soft tissue instead. And perform this technique daily or multiple times a day whenever you need immediate relief, as it releases tension, improves blood circulation, and prepares your muscles for strengthening exercises. Doing this consistently helps prevent the knots from reforming quickly and can dramatically reduce hip pain over time. Step 2. Glute strengthening exercise. Now that we've released some muscle tension, it's time for Step 2, strengthening, crucial for preventing hip pain from returning. focusing on a specific gluteal exercise that mimics the natural action of your hip muscles and is highly effective. Strengthening the glutes not only supports the hip joint, but also improves posture, stability, and overall lower body function. This exercise is a closed-chain movement, meaning your foot remains in contact with the ground, which is excellent for functional strength. To begin, stand upright, placing your weight primarily on the leg of the hip that has been sore, using a wall or sturdy furniture for light support if needed. Focus on balance and maintaining proper alignment throughout the exercise. Focus on the pelvic tilt by engaging and squeezing the gluteal muscles on the outside of the pelvis of your standing leg, slowly tilting your pelvis upwards on the opposite side, imagining lifting your non-standing hip towards your ribs. Keep your body and opposite leg in a straight line as you perform this movement, avoiding leaning or twisting your torso, moving very slowly and controlled, feeling the work happening in the glute of your standing leg. Once your pelvis is tilted up as far as comfortable, slowly lower it back to the starting position, controlling the movement using your outer hip muscles, not letting your pelvis drop. Avoid using your other leg or back muscles to compensate. The power should come directly from the gluteal muscles of your standing leg, isolating the correct muscles for strengthening. Always listen to your body, feeling a gentle burn in the working muscles, stopping when you feel it, and performing anywhere from 2 to 10 slow repetitions as a great start, prioritizing quality over quantity. This strengthening exercise can also be performed daily, helping you progressively build stronger and more resilient hips, which reduces the risk of pain returning. To maximize results, especially initially, perform the tennis ball release just before the strengthening exercise, particularly during the first week, as it relaxes the muscles, making the strengthening more effective and less painful. You might notice immediate relief from the tennis ball technique, but lasting benefits from strengthening may take longer, potentially a week or several weeks. So be patient, as consistency is key. Even after hip pain subsides, continue these exercises as maintenance to prevent recurrence, considering it an investment in long-term hip health and comfort. Once pain is significantly reduced or gone, reduce the frequency of strengthening exercises to 2 to 3 times per week for maintenance, and use the tennis ball release as needed whenever tightness returns. Your long-term goal is to perform at least 20 repetitions without feeling a significant burn, indicating good strength and endurance, maintaining this a few times a week. Consistency is the absolute key to success, regularly performing both the tennis ball release and glute strengthening exercise for the best results, addressing both immediate tension and underlying weakness. An ideal routine includes daily tennis ball release when experiencing pain, followed by glute strengthening daily or a few times a week for maintenance, a synergistic approach that is incredibly powerful. Sometimes a stiff or restricted pelvic joint may contribute to struggling hip muscles, and if these exercises help but don't fully resolve your issue, consider exploring that possibility with another video we have on addressing joint issues. Remember to listen to your body, be patient, and celebrate every small improvement, as your body is capable of healing and strengthening, and you're taking positive steps towards better health. If you found this video helpful, please give it a like and consider subscribing to our channel for more health and wellness tips, as we're here to support you on your journey to feeling your best. Finally, please remember this information is for educational purposes only, and always consult a doctor or qualified healthcare professional before starting any new exercise program, especially if you have pre-existing medical conditions or severe pain, as your health and safety are paramount.